Hello, I'm Ali Khan, Dean of the College of Public Health here at the University of Nebraska Medical Center, and I'm delighted to share with you today contact tracing, a time-honored public health tradition. So what we're going to do today is talk about the history of contact tracing, the epidemiology of COVID-19, some of the issues around contact tracing for COVID-19, and then I'm going to specifically talk about the Nebraska approach, since most of you are new contact tracers here in Nebraska. We have been doing contact tracing for decades for infectious diseases. So essentially finding individuals who have been exposed or are contacts of somebody who has an infectious disease. And here's some examples of diseases for which we do contact tracing: smallpox, TB, bacterial meningitis, plague, hepatitis A, or measles. We also do contact tracing, but it's called partner notification for sexually transmitted infections. And there's a storied history of the Disease Investigation Service of people who would try to identify these contacts of individuals who had syphilis and other infectious sexually transmitted diseases. The best way to explain contact tracing, I think, is to think about the incubation period. So unlike the movies, when you get infected with a microbe, it takes some time to manifest the illness or the disease. And that time from getting infected to manifesting the disease is called the incubation period. And that is the time you have to prophylax somebody, treat somebody, vaccinate somebody. So for example, if you were exposed to somebody with measles or smallpox, we would vaccinate you right away so you didn't get that disease. Or in our case with COVID-19, since we don't have drug options, we don't have vaccine options, we have a quarantine option, which is let's put you in quarantine for 14 days so that if you get sick, you don't expose somebody else. So essentially interrupting that chain of transmission. And this is a cartoon to show you how that works. So you have an individual who infects some other individuals who then go on and infect some other individuals. But anytime you can find their contacts and keep them from infecting somebody else, you are slowly breaking those chains of transmission. And eventually, if you do a good enough job and find enough of those chains of transmission, you can eliminate transmission within a community. Let's talk a little bit now about COVID-19 and the coronavirus that causes COVID-19. So first, why coronavirus? So there is the Tiger King, and I call coronavirus the viral king. Corona sound is for a crown. So the virus has little spikes on it. So it's a crowned virus. A number of these coronaviruses cause the common cold that we all have. But there's some that are very problematic that cause severe lung infections. Those tend to be zoonotic or animal-borne, and the host seems to be bats. And the first one is called SARS, Severe Acute Respiratory Syndrome. It's due to a SARS coronavirus. And what likely happened with that outbreak in 2002, 2003 is a bat infected some sort of civet cat in a wet market where people buy these animals, and that infected a human and caused the SARS outbreak. There's another version called MERS, Middle East Respiratory Syndrome virus. In that case, it's camels that act as this intermediate host, which is the technical term. So bats to camels to humans. And then for this virus, SARS coronavirus 2 that causes COVID-19 was a pangolin in a wet market that infected a human and then caused, these 2 million odd infections that we're dealing with. So that's the disease COVID-19 caused by SARS coronavirus 2. The disease is a severe respiratory illness. It starts in the upper respiratory tract and then moves into the lower respiratory tract. The usual symptoms are fever, difficulty breathing, a dry cough, and the tightness in the chest are the symptoms that we worry about. What it doesn't cause, it causes a runny nose, sneezing, sore throat. Those are more sort of allergy, cold-like symptoms. Now, most people fortunately do better, but it can be very severe for individuals who are elderly or people who have underlying health conditions. So if you have diabetes or heart disease, chronic lung disease, those individuals can have very severe illness. CDC estimates that the symptoms of COVID-19 occur 2 to 14 days after exposure. So that goes back to that incubation period, right? That's the heart of the work you're doing, right? Is find people before they develop disease during that incubation period. Now, unfortunately, while that's the range, the truth is most people get sick in 4 to 6 days. So you really don't have a whole lot of time to find the contact. So you have to be quick and you gotta be good. The disease causes worldwide, we've been seeing about a 6.9% of people who get sick die. In the US, it's 5.3%. So nothing to trifle with, you know, so influenza is 0.1%. So this is a severe illness in the United States and worldwide. The disease is transmitted by droplets. So this is when you talk to somebody, you know, you're sort of spitting, you're sneezing, you're coughing. Those droplets is what infects somebody, but also from direct contact. So those droplets can fall on a surface, and if you touch that surface and then come back and touch your mouth or nose or eyes, you can get infected. And based on that, you can sort of probably figure out, and you know already, what are all the prevention stuff. Yeah, lots of hand washing, clean all those surfaces, stay home if you're sick, cough into your sleeve. You know, it's all the things that we do to try to make sure that you don't infect, you don't get infected and you don't infect somebody else. Now, a common term we're hearing people talk about these days is the basic reproduction number. So epidemiology all of a sudden is super exciting, or the R naught. So if you have a basic reproduction number of 1 or less than 1, the disease can't continue, because you need to at least infect 1 more person or more for the disease to continue. Now, unfortunately, with COVID-19, the reproduction number is probably somewhere between 2 to 5 or 3.5, 2 to 3.5. So each case causes 2 to 3 or 3.5 more cases. And that's why we were seeing sort of this increasing number of cases going up in the United States until we did social distancing to sort of slow that down. And this is why you're looking for those contacts to sort of make those contacts go down. Now, while most people infect 2 to 3.5 cases, this disease is very problematic. Actually, most of these zoonotic coronaviruses are problematic because of a phenomenon called super spreading events. And that's where an individual infects 10 to 15 or more. And here's an example in South Korea where patient number 31 infected 100 people. Here's another example in Washington State in a choir rehearsal where an individual infected 45 people, of whom I think unfortunately 2 died too there. So these super spreading events are very problematic. And another reason we need to get on top of these contacts, because you don't want one of your contacts to be lead to one of these super spreading events. And then that can markedly spread the disease. This is technical, but trust me, you want to pay a little attention to this. So basically, this looks at what the probability of transmission is based on the day of illness, okay? And what I want you to pay attention to, so this assumes an R naught of 2, which is that you're going to infect 2 additional people, and the little colors are for the ways you infect these 2 additional people. And you'll see almost in this model, 45% is this blue. This blue, light blue, is problematic because it's pre-symptomatic. And what that means is that unlike many diseases where you infect people after you have symptoms, with COVID-19, you infect people up to 2 days before you have symptoms. And this is why we actually tell people to wear masks, because even if they're being good citizens and staying home when they're sick, you know, they're out and about when they think they're fine, but they still could be infected, and they're infecting others because they're infectious 2 days before they have symptoms. And this also helps explain why when you're going to that index case, that first person who has illness, and you're asking them, who did you have contact with 2 days or 48 hours before you became sick? That's why you're asking that 48 hours before they became sick, because that's when they became infectious, 48 hours before they became sick. And then obviously following that until they went into isolation when they could have exposed somebody else. But this helps explain to you why you're starting 48 hours beforehand. It also explains why it's so hard to tackle this disease, because people are spreading it when they think they're absolutely fine. Here's a snapshot of the United States: 826 cases, 45,000 deaths, back on the 22nd, for those of you who are watching it today. Here's a progression of disease in the United States. As of the 18th, when this was drawn, cases had plateaued in the United States, which is good news. We didn't want this. So this was the whole R0 of 2 to 3.5, which is growing, social distancing, sort of plateauing it off. But this is where we need you, right? Everybody listening to me right now, because you're going to help us do this. You're going to help us get this curve down, decrease transmission within our communities. So this is you, right? So President Trump has released guidelines for opening up America again, and there's 3 core components to those guidelines. Component number 1 and 2 is decreasing symptoms in the community, decreasing cases in the community. And number 3 is making sure that we have sufficient healthcare capacity to take care of patients. But decreasing symptoms, decreasing cases means we are finding every case and isolating it, and we're finding all the contacts, tracing the contacts, putting them in quarantine. So essentially the president's depending on you to help open up America again. So people have framed this numerous ways. The CDC director calls it, his is the tackle and block strategy. This is the boxing it in strategy, which is test widely, isolate the infected people, find their contacts, quarantine them, you know, and keep doing that until you box it in and we're all done. And what's the rationale for this contact tracing? Back to what we've talked about, right? So if you find them early, you can do the early isolation. So you can go down this loop, early isolation, which means they won't transmit to anybody, right? Because they're at home, they're not walking around anywhere, no more transmission. You broke that chain of transmission. The other thing about early detection and finding these individuals is early treatment, right? So if they do get sick, you know, you already have them under monitoring. You can immediately bring them into the hospital, treat them immediately. If they're going into a drug study, they can go into a drug study immediately. So you're actually doing the right thing for them, even if they get sick. Not if they, you know, you're preventing transmission in the community, but you're also doing the right thing for them if they get sick, because they'll be able to get faster care. So wonderful reasons why contact tracing is really important. Okay, so now let's just go to contact tracing for COVID-19. And okay, so this is a schematic of what you're going to be doing. So confirmed case in some states, if there's enough capacity, it may not just be the confirmed case, it may also be suspect cases, and we'll talk about that in a minute. You interview the confirmed case, you interview the suspect case, you find the contacts, the ones that, you know, the person remembers, and then you put them into quarantine, and hopefully they either don't have any symptoms, they don't develop disease, or if they do develop disease, you sort of move down the process and find their contacts. And what you're trying to do is make sure you have as few missed contacts as possible. So that's your goal, right? Find as many contacts as possible, as quickly as you can, so you can isolate them and reduce the spread of disease. This is a more technical schematic of how this works for those who are of you are interested, but hopefully I've explained it well enough. But for those, but you'll have my slide set if you want to go back and look at how this works. But if this is a case A, who has contact with two people who are then going to cause additional cases. If you trace the case, so for example, you trace B, they're not going to cause these additional cases, or by the time you put A in isolation, she's not going to cause this case. But if you failed to find case C, then he caused these cases. So it's essentially the same concept. You've got this incubation period. This incubation period is your friend, because that's the time you have to find your exposed individuals and get them out of the community and into quarantine. And it's also your clock, right? Because you got to do it quick, because you don't have a whole lot of time to find them and get them moved out of the community. But the more of these little X marks you can have, the faster you can decrease transmission within the community. This may be a little technical, but it's just to make the point. These both curves say the same thing, but the point they make is this is the number of contacts traced, and the more contacts you trace, depending on what the basic reproductive rate is, the faster you get to 1. So this is a basic reproductive rate of 1. So we're all trying to get below a basic reproductive rate of 1. That's our goal, right? We want each case to cause less than 1 more case. And the higher the basic reproductive rate of the disease, the harder it is to do that. But that's our goal. Increase the number of contacts we trace. Okay, so what I'm going to do now, this just came out. This is CDC's contact tracing guidelines that support the president's guidelines to get and keep America open. Key concepts: trace and monitor contacts of infected people. Notify them of their exposure and support the quarantine of contacts. Expand staffing resources. I think that's talking about you right now, and digital tools, which are up and coming. Yes, part of a multi-pronged strategy, right? You have to isolate cases, you need to do contact tracing, and then you need to make sure healthcare systems are protected. You need to make sure that you've taken care of preventive measures in facilities. So there's a lot of other things you need to do to make sure you can reopen, but contact tracing, reducing transmission is the key one, is the core thing. See, communities must scale up and train a large contact tracer workforce and work collaboratively across public and private agencies. Yep, that's all talking about you who are listening to me right now. So here are some of the core principles of contact tracing that must be adhered to. And I'm going to leave these up for a second because these are all important. And again, you'll have the slides. But this is about, supporting patients with suspected or confirmed infection, as I said. And your job will be to help them recall everyone with whom they had close contact during the time that they were infectious. And then warn those contacts that they have been exposed as rapidly and sensitively as possible. You're going to be very careful to protect patient privacy. So we never tell contacts who exposed them, ever. They may guess, but that's for them to guess, but it's not for us ever to tell them who exposed them. And then, we provide the contacts education, information, help support them, because trust me, somebody's going to be very worried when you come to them and say, hi, you have been exposed to COVID-19. And so you need to be very careful of that. And, depending on what your role will be, you may well be doing that part. Also, and then, providing them guidance about what they need to do, social distancing, 14 days of quarantine, how do they monitor themselves, whether they're using an app or not using an app. That's all going to depend on what systems the state has up and running by the time you are charged to be a contact tracer. I left this piece up of the guidance. Basically, time is of the essence, because even though we say the incubation period is 2 to 14 days, most people are sick way earlier than that. So you really need to find these people as immediately as possible who are sick, and then you need to go find their contacts, interview them, and find their contacts as fast as possible. We're going to talk about this a little bit more in a minute of who is a contact, but someone who's been within 6 feet of an infected person for at least 30 minutes, starting from 48 hours before illness onset until the time the patient is isolated. And then these contacts should stay home, maintain social distancing, self-monitor until 14 days from the last date of exposure. So notice this 48 hours before illness onset. And that 48 hours is, as I told you, because you are shedding virus and infectious 48 hours before you have symptoms. Now, finding household contacts is really easy. There are some contacts that are harder to find, right? If you work in a healthcare facility, if you work in a group home, homeless shelters, lots of other sort of these correctional facilities, these large facilities. And in those cases, you will be working with your supervisor, the local state health department, the managers at these facilities to try to put together a better contact list to try to find these individuals. And this is just to make that point that that contact tracing is a lot more difficult than just, you know, Susie, how many people did you live with? How many people live in your household? So who is a contact? So this is from Resolve to Save Lives. I've left you the link there if you want to follow up. But as I said, 48 hours prior to symptom onset through the beginning of isolation, or if they didn't isolate, then 7 days after symptom onset and 72 hours after their fever resolved. Household members, intimate partners, individuals providing care, individuals who had prolonged household contact, close contact has a start, and any refinements of this will come in your conversations with your supervisors. You want to find as much information on this individual as possible. Often, and I think they should probably state here somewhere, you ask the individual you're interviewing, can you sort of like pop open your cell phone so you can get as much detail on these individuals as possible, because you need to go find them, because somehow they need to be then contacted and told that they are a contact. You will contact them anonymously, depending on what the systems are set up to do that. And HIPAA compliance, right? You need to make sure that you're careful about all those sort of things of confidentiality, etc. Now, what you have in front of you is my absolute favorite tool for contact tracing. Yes, it's a calendar, right? Not very sophisticated, but what I usually do is I sort of mark the days that my index case has been infectious, and then once I mark those days, then before I even ask the index case, excuse me, ma'am, you know, what were you doing on July 13, 14, 15, 16, 17, 18? I asked them to help me anchor those days. So, you know, so if it's July 4th, I knew it was the holiday. I knew it was the weekend. Anchoring is a little harder these days because most people are staying home, but maybe there are some anchors for them. Did a birthday happen? Did somebody special visit? Did they do something special? There's a TV show they watch. So if you anchor those days for them, it's easier for them to remember what happened that day. And then with those anchors, I then go back and then say, okay, so let's look at Tuesday the 7th, right? That was the day that your son told you that he got admission to college, right? What happened that day? Who were your contacts that day? You didn't go to work that day, okay, but on the 8th, you did go to work. Who did you see? So I find a calendar to be my greatest tool when I do contact tracing, when I'm talking to the individual who has the disease. And having those anchors makes it easier to have that conversation with them than just saying, sir, 2 days before you were sick and 7 days after you were sick or until today, who were your contacts? So you have to use a couple of different strategies, politely, of course, but continue probing until you really get a good sense of what their contacts are. You know, if you think about the first case we had in Washington, there was a good effort to try to find all of those individuals' contacts, but we know we missed somebody because 1/4 of all the cases in the United States are linked back to some missed contact, probably from that first case in Washington State in the United States. Okay, high risk settings require additional help. Most of this work will probably be done on a computer. Will you be putting in these contacts? But some of, yeah, I think it says an app in this, but it's probably a computer or an app. But some of this will require some additional assistance and work with your supervisors, maybe contacting them after you contact the manager at these facilities. You may end up contacting the media to tell them of exposure because you can't find each and every one, but you'll work those out as over time. You have to notify the contact, interview the contacts to tell them what had happened, and then support them, thermometers, etc., give them the appropriate advice, and then monitor them for 14 days. So that's sort of the full spectrum of the things that happen in contact tracing. And I'll be honest with you, I'm not sure in that spectrum what part you play within that spectrum, but that is the full spectrum of contact tracing for those of you who are listening in today. All right, so let me end with Nebraska specific issues. So these are the current case definitions for COVID-19 in the United States. So confirmed is somebody who has a positive laboratory test. Probable is somebody who has the symptoms and known exposure to somebody who is a confirmed case. So they're likely, they're going to be a case if probably by the time they get tested. We tend to do all contact tracing on all confirmed cases. And if there's enough resources and people, then you also start doing contact tracing on the probable cases. Again, you're trying to pull as many of these people out of the community as possible. And given that time is not your friend, or I guess the incubation period is your friend, but the time is not your friend, you want to find as many of these people as fast as possible. So it's, as it says, as resources allow, you can do the probable cases. And again, that wherever you are and what their strategy is. What you really want to find is you do a risk assessment for cases. What you want to find is the high risk contacts, right? The high risk contacts we know are household contacts, work contacts, people you've had a lot of high risk contacts are people you have a lot of contact with. That's kind of redundant, but you know what I mean. So those are the individuals you really want to find, because we now have lots of data that those are the ones who are most likely to get sick. It's not somebody that you sort of casually passed in the street. So these are the ones you want to do all the probing for to really find those individuals. And here's some sort of good definitions to help you kind of find those individuals. This is to help put that all in perspective of what the full case investigation is going to look like wherever you are. And your part in this is here to identify all contacts of a case within 48 hours, help with the risk assessment, support the quarantine and monitoring. But this is a part of the bigger case investigation of finding the cases, supporting the local health departments and doing all this work, field work and data work and operations work and communication work all around helping us reopen the country. I mean, we are truly depending on you to help us do this. Finally, there may actually be some new tools available to us shortly. China is already using these tools. These tools have been developed in Europe, and they're now being developed by Apple and Google here in the US. And essentially what will happen is your cell phone will keep track of other cell phones it's been in contact with. And this is a little cartoon to show you two cell phones meeting on a bench and saying hi. And then if one of those individuals becomes sick and it's confirmed, the cell phone lets the other cell phone know back here, hello, somebody you had contact with is sick. You may want to quarantine. Now, the way this system is designed, you will not have this data necessarily because it's meant to stay on the cell phone and there's all sorts of privacy issues. However, what the cell phone did record was, hi, I was in the park on Tuesday at 2 p.m. I was at the shopping mall at 6 p.m. And what you will get is something like this that will say these are all the places the individual had been and at what time. That could help you in your contact tracing effort. So the tools are getting better, and you'll have additional tools that help you understand what's going on with contact tracing. Okay, that's it for me. Be good, be quick, and good luck.